Hey everybody, Dr. Kuniak with a weekly video lecture. So I've had a couple of questions about the research process and particularly the literature review process from folks. The questions have kind of been about so what is it if you have an idea for a topic but you're not really finding a lot of literature on the topic. Other questions have been related to what if I find too much information on the topic. Some folks have asked what do I do if I have this kind of broad topic but I don't know how to focus it in specifically. And so I think there's, and then even further, some follow-up questions have been related to asking how best to ask a research question. At some point we're going to talk about purpose statements. Maybe that'll be my next video lecture because I think it's a next step in the process. But let's start talking about kind of how you start. I have a couple of ideas to approach this, and so I'm going to try to go in as best an order as I can from where I sit. The order that makes most sense to me. So let's say that you have a topic and you aren't finding a whole lot of research on it. A lot of time. Pause. Let's start with this. So you have an idea. Generally speaking, you want to look at a given population, a particular diagnosis, a particular treatment orientation. So we like to think about that as a big idea, a broad idea. And so I want you to think about this process as kind of like an upside down triangle. So here we are at the top, and the goal is to focus in until we get to the point of the triangle at the bottom. So it's going to start at the top with this big, broad idea of drug and alcohol counseling. Let's just say that off the top of my head, or anxiety. Well, something like that. So I'll start with drug and alcohol counseling. There are all sorts of different things that you could focus on with drug and alcohol counseling. You could focus on specific substances that people use. You could focus on specific interventions that work. 12-step groups versus not 12-step groups. Multiple pathways to recovery is one of the themes that's out there right now. Complete abstinence, relapses. It's broad, and so as you focus in, maybe you like the idea of looking at relapses leading to recovery. That relapse is part of recovery is one of the phrases you hear a lot in drug and alcohol counseling. So we're bringing this in a little bit. You want to take this idea and get it down to a simple research question. But somewhere in the area that we're just talking about right now, where we've gone from drug and alcohol counseling broadly into relapse leading to recovery, this is where you can start looking into the literature and see what's out there already. Some professionals might be researching resiliency as a topic associated with relapse and recovery. Other folks might be researching specific substances that are maybe easier to struggle with a relapse on, or others that are harder to struggle with a relapse on. Some are going to look at medication management oriented treatment as opposed to no medication abstinence. Some are going to look at agonist treatment versus just you get the idea. So now we're bringing this in closer. So you find, the idea of relapse prevention sort of becomes interesting to you. You'd like to approach non-medication assisted treatment models. You find that there's a decent amount of research out there on this particular topic. So how do you then focus this in? Well, first off, you want to kind of close your, you want to stratify your results to within the last 5 or 6 years, ideally, especially if there are a lot of research articles out there. If a lot of people are looking at the particular topic area you're looking at, you want to see what's kind of most current. Sometimes I find that when I do that, the first thing that happens is all of a sudden, all of this research that I'm looking at is too specific. It's looking at very specific populations. It's looking at genders, sexual orientations, cultures, different age groups. And so now I have to ask myself, well, what is the population that I'm really looking at? Or maybe I need to broaden this back out again. But I think it helps to start with, date range. I was just searching for a particular type of assessment tool that I want to look into, related to a concept called sense of belonging. I just randomly, I knew that's kind of globally what I wanted to look at. I wanted to look at how communities are built, particularly in online environments. And so the phrase sense of belonging stuck out in my head. So I did a Google Scholar search of that just to see if anything exists out there. And lo and behold, there's a sense of belonging assessment instrument, the SOBI, sense of belonging instrument. So I started looking into that and seeing that there's actually a decent amount of published literature on this. So that was good. But I wanted to get some of the original articles about the sense of belonging instruments, so that meant I had to go back further than the last 5 or 6 years. Totally appropriate to draw in some like seminal studies that are older literature. But we want to make the bulk of what we're doing more recent. We also, though, want it to fit the other variables that we're looking at. So I hope that you're seeing that this whole process of trying to take that big idea and shape it down into the triangle, the point of the upside down triangle, can take a little while, and that's okay. It's important to kind of think about what it is that you want to research, see what's out there, refine the search a bit, see what you're getting back, dabble with those topics a bit, refine the search again. In a good research article, you can have quite a thorough literature review. So it's not saying that you won't need all of that stuff you're finding, but if you have a lot, you want to kind of focus in. Another way to think about the way that we focus in on a particular topic, and this, I can't take credit for this. This was actually when I was getting ready to do my dissertation. My dissertation chair shared this example with myself and some other students, where his office was at, and I shared this with a few of you already, but I didn't share it with everybody. So where my professor's office was, he looked out on there's a large fountain outside in the courtyard between the buildings at Duquesne, where Canavan Hall is, where we did our counseling program. And so he was talking about this idea that you might be, if somebody was to set out and try to research fountains. Let's use this fountain as an example. So the fountain is that big idea, but if you're looking at the fountain, all sorts of questions should start to come to you. Are you talking about, the structure of the fountain, the type of concrete you might use? Are we talking about the emitters, the water spouting out? Are we talking about the height that we want the water to go? Are we talking about the color of the water or the clarity of the water? There are actually times where they dye that fountain to be different colors for different seasons or different events or things like that. Are we looking at single font fountains? Are we looking at multiple spouts to our fountains? And then if you really wanted to, are you looking at all the stuff that's below the surface too? So are you looking at the pipes? Are you looking at the machinery, the motors that will work the pumps, the pumping mechanisms, the chlorine to clean the substance, or alternative chlorination systems, or how large do you want this fountain? Are you looking at self-sustained fountains, or are you looking at these broad, like courtyard fountains with a pool and everything, as this fountain was? So that is how we take the big idea and we start focusing down in on it. So if I wanted to research fountains, I don't, but if I wanted to, I'm sure that I could find a ton of research on any individual one of those aspects of the fountain, and it's possible that someone is making their career out of each of those aspects of fountains or other mechanical instruments, or landscaping, or whatever the case may be. Like, they may specialize in some of those different areas. So it's no different for us. Hopefully that example, thinking about these broad topics and shaping it down, is helpful. And if you have a lot of research out there, you really want to consider what other variables you're looking at. So stratify by timeline first, see what's kind of cornerstone information that you absolutely ought to have, need to have, see what's the stuff that really focuses in on the variables that you're looking for, so on and so forth. The other thing that you want to take a look at is you want to consider, if you don't have a lot of research, it is possible to look up research on each of the different variables that you're looking at. So, for example, my dissertation just comes to mind as an example of this, because I was doing this when I was, first learning how to kind of guide a research study. There was not a lot of research out there at the time on gaming broadly. So I gathered up as much literature, there is now, but at the time I gathered up as much mental health related literature as I could. A lot of it was actually pretty negative stuff, but that's what existed in the pool of literature at the time. I then also looked at some of the other variables. My dissertation focused on theories of personality, coping strategies, and resiliency. Those different variables came to mind as interest areas for me, and then I found out that they were also kind of linked. There are studies that link personality and type of chosen coping method, and there are studies that link coping mechanism and its level of success associated with resiliency. So I had some other variables that I was looking at, but I decided that 3 was plenty. 3 independent variables was plenty to take a look at for one study. You really only need 1 potentially, but 3 was more than enough. Dissertations are meant to be bigger and more involved, so that worked. But I started looking up literature on personality types, coping strategies, and resiliency separate of gaming. It had nothing to do with those specific topics. I probably wouldn't have found any literature out there on that 4 variable grouping. So if you don't have a lot of research associated with the topic that you're looking for, you might have to look at the variables independently as opposed to how they interact with one another, and gather up as much research as you can, as much literature as you can on each of these different variables and how they interact with one another or not, for that matter. You can just focus in on the variables themselves. Hopefully that's helpful to think about. The last piece that I want to touch on very briefly here is how you ask your research question. And so it really does come down to thinking about those variables. I have a little formula that I will... I don't think I can share screen with the program that I'm using right now, but I will read it to you, and I can certainly post it up in D2L. The research question format that I use, and this needs modified based on whatever it is you're looking for, is basically, is the name of the intervention, the population, the whatever the case may be, your independent variable. So is the independent variable effective for treating blank? So is blank effective for treating blank? And then you could add diagnosed with blank. So, for example, we might say, is CBT effective for treating the drug and alcohol population, or an individual struggling with substance abuse, let's frame it that way, diagnosed with anxiety? You don't even need the diagnosed with. You could just ask a research question and say, is CBT effective for treating substance abuse? You could make it more specific. Is CBT effective for treating substance abuse in veterans? In World War II veterans? I don't know. You could be as specific or as vague as you want, but that format generally tends to work for trying to see if you can make a research question fit. Modify it as needed. That's not like a set in stone. Somebody shared this with me once, I wrote it down, I kept it, and I use it, and so I will save it in D2L for you. But is blank effective for blank, and then on from there. It's that simple. I know that I'm making it sound light and everything, and I know that it's harder for some folks than others, but it really is thinking about how to organize yourself around these topics, and it's unfamiliar to most people. So hopefully some of these pointers are useful for you. Hopefully this helps get you started. Let me know if you have any questions about this or anything else, and we'll take this into its next stage in our next conversation. See you all online and in the discussion boards and all that.